Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of the Common Sense MD. Today I have a special guest. I've been trying to get him on here for quite some time. His name is John Hawkins, and he is our rep for our home sleep studies that we've been doing for quite a while now. Matter of fact, that's how I discovered I had sleep apnea myself. So he's a very knowledgeable guy about all this stuff. He's worked in the industry for years. I trust him, and he's just a great guy too. I like him. Thank you for coming in to see us today. I've been trying to get you on here for a while.
Thanks for having me.
You're a busy guy.
You've not as busy as you.
Involved in the rescue efforts near Irwin, and thank you for that. That's
You're
up
welcome.
near where we live. But talk to me about sleep apnea. Sleep apnea is so common. When I found out I had sleep apnea, here I'm a skinny person. I used to think that it was just overweight people with big necks,
Sure.
or short jaws or whatever, but it's not true. I think most adults, definitely ones that snore, probably have sleep apnea. It's common, isn't it?
It is. Really heavier and overweight people, we tend to see more of them having, positive signs for sleep apnea. But it's kind of funny. I was just reading something before I came in a little earlier this morning. When you snore, it doesn't necessarily mean you have apnea. It's very interesting.
It's not, yeah.
But about 3 out of 5 people in the U.S. that have sleep apnea, and it goes undetected. And it is known as the silent killer. So
Sure can. It can cause everything from sudden cardiac death to AFib to high blood pressure, stroke. I mean, it's really dangerous. People just don't realize it and how easy it is to treat. Do you think that as you get older, because I'm trying to figure out why I never had it and now I have it, as you get older, you lose some of the muscle tone in your upper airway?
that's correct. And one of the first places you gain weight or tend to gain weight over the years is in your throat, which is when you start gaining weight, they've learned that's one of the very first places that you actually gain weight. So that causes your airway automatically when you're sleeping to collapse and have a tendency to close up. So
that is really interesting to me. So we know it's common. We know it's treatable. The problem with sleep apnea, in my opinion, through the years of me diagnosing this on my patients, is getting them to go to a sleep lab. Number one, nobody wants to sleep in a sleep lab, spend all night with somebody watching you with tubes hooked up everywhere. And then you have to go to the bathroom and you don't want to be there. Plus, there's about a 6-month wait list on a sleep lab.
yeah.
I mean, it may be the gold standard, but for a lot of people, it's impractical. And so when I did your home sleep test, I was very impressed with how easy it is. It's a ring on your thumb. Talk to me about home sleep test versus sleep lab.
Sure, absolutely. So you get the same 6-channel study with a home sleep study now as you would going into a overnight lab. The technology is phenomenal, what they've created over the last few years. Sleep Image is one of the big players, and that's the company that we use for the diagnostic equipment. And a lot of labs are switching out from the old hardwired apparatuses they were using to Sleep Image rings. It tends to be a more accurate test, believe it or not, than the old EEGs and the lap bands and the chest bands and the misters under the nose and all that stuff. So it's very it's recognized by the sleep board of sleep medicine. The ring was tested at both Johns Hopkins and at Harvard Med. So it's got some pretty big prestigious institutions behind it. It's an FDA approved product, and it's easy. We got about a 98.9% compliancy rate with patients. Versus going into a lab, and I ran a sleep lab locally in Knoxville for about 2 years, and out at Oak Ridge, and I would see a lot of patients, it seemed like, having a difficult time in the environment.
Falling
first
asleep.
night, falling asleep. And so typically you end up always doing a 2-night study. Wow. And really, I believe it's because the first night, it's a foreign, place to them. I know when I go to a hotel room for the first night when I'm traveling, I have a very hard time sleeping.
I'm the same way.
And I always have. But then the second night, I'm kind of fine. So that's, you're really getting your baseline when you go have a in-house study done on the first night. And then the second night, I say you're typically settled in and sleeping, so they get some good data on you. But we do basically the same thing with you with the ring, the image ring.
2 nights.
2 nights. That's what we
Show
suggest.
them a picture. Hold
Yeah,
that
sure.
ring up.
So this is it. Goes on your thumb or your second finger, and it's that simple. You turn it on. It connects to an app on a smartphone that we send you, that you download, and that collects all your data. And from that, it's all downloaded in the cloud and shifted, right back to us immediately, so we can expedite, reading, and it's read by a board-certified sleep physician. And then, of course, they send it back, the results, to a group like Dr. Rogers' group and any of the providers in the group, and they get a 5-page detailed report of what, it looks like, and are they positive for apnea, are they not? What's their desaturations look like, heart rate, those types of things. And from that, you can determine, do I feel like I need to send this patient on to a pulmonologist, or do I need to send them on to a neurologist or sleep specialist? And in most cases, the PCP can with the testing and the results, they can diagnose it themselves. They can figure it out, and it's one way of really keeping control of your patient too.
Yep, I agree. Not only is this test easy, but when I get the reports, it's very understandable, and the recommendations are there. I've realized that I can treat it as good as probably anybody.
Absolutely.
Routine cases. And this test actually differentiates between obstructive sleep apnea and central sleep apnea, which is important.
That's true. And years ago, when we used the old type of equipment, it would not determine, a home sleep study would not determine central apneas. It could not differentiate.
Right.
So that was a big breakthrough with this technology, and that's one of the reasons why insurance companies now are a lot more apt to approve this study versus you having to. Plus, it's about 3/4 of the cost versus going for a 2-night study. I mean, a 2-night study in an overnight lab is about $6,700.
Unbelievable.
So, looking at high deductibles, out of pockets, I mean, it's with ours, it's $349 if you have to come out of pocket for a 2-night study.
Wow.
That's reasonable. There are some people I know out there that can't afford that, but we really try to work with the provider and the patients to drop that price if they really can't afford it.
I love that. And most insurances cover that anyway, don't they?
They do.
It's unbelievably
It's usually covered 100%.
That's just unbelievably inexpensive. In my own mind, I look forward 5 years from now, and I think a lot of the sleep labs are going to go away. I just do.
A lot of them have already.
Yeah, I just can't believe anybody would want to do that unless they absolutely had a very complex case where nobody could figure it out. But I found out that it's really easy for me to treat it, not only too because I have it, I'm used to using a CPAP machine, but when you get that report, you put recommendations on there and we just check it off. Right. And then they go to their DME, which you are not associated with because that would be bias. Right. So that's another thing I like about your company. You're not trying to sell a CPAP machine. You're just making the diagnosis. And then you may have some recommendations on whether you go to Respicare or Lincare, or that'll be probably up to the doctor to decide where to send you. And then you go, and they have respiratory therapists that will teach you how to use the machine, which is very easy. If I can do it technologically wise, anybody can. But it certainly really helped me a lot. It surprised me when I got the diagnosis, but your company has made it so easy for the average doctor. You don't have to be a specialist to be able to treat somebody with sleep apnea very effectively.
Sure. Well, and now, with the Affordable Care Act and all that pushing everything through the PCP, you guys really have ultimate say and control of the patient. And so that's one of the things that I've seen the increase in my business. We call on really anybody that would benefit with their patient population of using this for diagnosing and testing them. Even for, if it's a vascular surgeon and they're waiting to try to get a patient in for, hernia surgery, but they've got to have a sleep study before they put them to sleep.
Yep.
We can do that for them. So I've changed some actual protocols on some surgery clinics to where they send patients to us directly so they can go ahead and get the sleep study out of the way and figure out if they've got apnea or not. Get that treated for them so they can go on and get them approved for the surgery. But back to the PCP and the Affordable Care Act, it gives you guys an opportunity to control your patient population and give them some, better services.
Exactly right.
And full rounded services, so to speak, and not have to ship them off to somebody else to see
As primary care doctors, there's really too much triage work. Really, a good primary care doc should be able to handle 95% of what walks into your office.
Absolutely.
And certainly that's what we try to do. But in any event, sleep apnea is so important. I've done several podcasts on it. I'm a big believer in finding out if you have this. We always try in functional medicine to get to the root cause of the problem. So instead of just getting, here's your blood pressure medicine, here's your diabetic medicine, you're overweight, here's your cholesterol medicine. Why do you have these problems? Are you eating right? Are you sleeping? Right. Are you exercising? What do your hormones look like? So certainly sleep is at the very top of everybody's list, especially as you get older. I mean, I'm a baby boomer. I'm almost 70 years old. How many people my age don't sleep well? 99% of them.
Right.
They come into my office. So I always try to ask them questions. I'll try to get them to do a sleep study, which is so easy. And your company makes this so much better that I'm very happy as a doctor to have a guy like you. When you walked into my office, and really, it was just amazing. It changed the way I did this sleep apnea stuff. So, John, thank you so much. We're going to put the information at the end of this and ask your physician or caretaker, provider, if you suspect it, how to get this test. It's simple.
Can I say one more thing?
You sure can.
Just about Blackstone Medical Services. So we do probably more home sleep studies per day than any other company. There's other companies out there, but than any other ones. We do about 1,900 a day.
Wow.
So you can do the math on that for the week. I mean, we're good at what we do with this, and I thank you for entrusting your patients to us. So we got to get these patients diagnosed. And because it is a silent killer, and there's too many people that probably are having heart attacks, strokes, and everything else because they don't know they have apnea. So.
Exactly right. It's part of a whole concept of getting yourself healthy. And if it's your obesity causing it, you need to lose weight, we'll help you with that. But you certainly need to know if you have this because it can be life-threatening.
Absolutely.
So, John, thank you so much for being on here.
Thank you.
We'll see you guys next week.